Next question. I took Wentong only 5 times, my legs became very swollen and the swelling worsened. The intensity was only at 4. Oncology.
Intensity of 4 is not small, it's actually quite a lot. Well, did the discomfort begin from the first sessions? Or, for example, you had the first session at a 4, right? And you immediately felt bad and then you continued for 5 more sessions. At which session did it start becoming noticeably worse? Just write it down so that we understand how everything happened.
I think the person is unlikely to reply. Well, if they do write, I think the issue will disappear and this question won't be clear.
Okay, well, I'll try to explain briefly. Look, if you're doing some therapy and you feel worsening right away, which can definitely happen, maybe the body is having a sort of reaction, then reduce the intensity, pause the sessions for a while so that your body can process this, adapt, and handle it, and then continue the same therapy carefully. And this can happen with any treatment, everywhere. Well, it basically concerns everything. But if this therapy is so uncomfortable that it's completely unbearable, then it needs to be stopped entirely. Just out of curiosity, did the person undergo the procedures 4 or 5 times, and each time it got worse and worse for them? Of course, everyone can have an overdose. For some people, a 4 is already the limit, and they will suffer from it. So, in your case, intensity should be set to 1, at most 2, and work with that. The body just can't manage its problems at high intensity. Therefore, yes, a negative reaction is quite possible.
Yes, and Wentong also removes, like bioenergy massager, this intoxication, intercellular space, and the whole cell. All of this is cleared immediately. And accordingly, what we call the exacerbation effect, this will definitely be present. And again, for some more, for some less, guys, and then there's this comment under this question saying that oncology, well, is not recommended. Yes, I repeat once again, these are the rules of our health standards. Pregnant women, children, and cancer patients are at risk, and they will always be listed in the contraindications. Because clinical trials are never conducted on these people. Therefore, whether it's dietary supplements or devices, there will always be a contraindication for such. Here you need to understand, and first and foremost, you should not be the one to make a decision for a person with cancer. The person themselves needs to figure out how it works and make the decision whether to use this device or not, so that later on, first of all, they cannot blame you. As Pavel also mentioned today, so that in the end no blame falls on the devices or on you.
I would like to make another observation. That is, they said that the tumor had grown. There is also an effect called loosening. Sometimes it happens that the tumor grows but its density decreases. That is something we would also like to know. At the same time, the pressure on the nerve endings decreases, so overall the condition might actually have improved. The body just suddenly started working through everything. When our temperature rises, the immune system starts to work, and usually tumors don't react well. They may regress, so to speak, but at the same time they can increase due to their loosening. There was a case in St. Petersburg, a brain neuronoma, where everything was already bad. Parts of the tongue, parts of the face, and parts of the body were numb. And during therapy, with another therapy, high rudotherapy, it happened that the tumor in the brain grew. But at the same time, the person felt better, their pressure dropped, and they were told, the tumor is growing, let's stop the therapy. And the woman said, I feel better. I've already started to feel everything, walking has become easier, let's continue. Well, it's good that we continued, and then gradually the tumor began to decrease, and only then did it become clear that in reality it had increased in size due to its loosening, and then gradually it began to subside and shrink. So keep this in mind too, and don't give up. Just reduce the therapy as much as possible to a comfortable level.